Here is the family vignette. My husband is center on the painting. He's posed like Death of Mural by David. He has a paper in his hand that says, "Go after them, Regina, love Fred." And that's because that's what he told me to do. Once he was the model patient at his hospital for the first 4 weeks. He didn't complain, he didn't make waves, he didn't step on anybody's toes, he tried to do everything he was told. And then on a Saturday morning, after we'd been there almost 4 weeks, the doctor came in the room and said, at 9:30 a.m., "We've decided we're gonna send you home on a PCA pump." And in the world of hospitals, that's basically, we've decided we're gonna send you home to hospice. And they decided this without talking to us. We said, "Well, what happened to the surgery? You guys were gonna do surgery, and you talked about chemotherapy, and you talked about treatment." They said, "Well, we decided this is the best course." So that's when, after the doctor left the room and we burst into tears because we were basically being sent home with a death sentence, that my husband said, "Okay, Regina, you can go after them now. You can do everything in your power to change things." And so that's what I've been doing ever since. I have constantly been fighting the system ever since. And that's what this whole scene's about. I'm all health all the time. Well, my name's Regina Holliday, and I'm a resident of Washington, D.C., and I'm doing murals for medical advocacy. Hiding in the crack of the door is my elder son. That's Freddie. He's hiding. Because this is how he felt during the hospitalization process with his father. I mean, when you're on the autism spectrum, oftentimes you have trouble with voice modulation. Your voice is too loud for the arrangements. So you get that negative pressure constantly of like, can't you keep your kids quiet? You know, and it's like, I'm trying. I'll just only have them here for 15 minutes, okay? So they can visit their dad. He was really sick. We need a societal shift in thinking and feeling. We need people to care about others. We have to turn people around. And I'm hopeful that my story will do it, because look at me. I mean, I don't have a job right now, other than I teach part-time art, but I'm out here. I'm working on it. I'm trying to do everything I can work toward reform. I'm taking every bit of money that I have and all my talent and my ability to work to help others. And all I'm asking is that everybody step forward and just do their part.
What happened now?
What happens now?
What did just happen? I mean,
well, we basically saw the motorcade go by over to the web conference, and so Lana saw us all standing here and supporting him. So hopefully he'll go into his conference and he'll have all that spirit behind him, and he'll be promoting healthcare reform.
Do you really think that was a success today?
Yeah, I mean, that's why we're here. I mean, you're here, media's here. People are going to know nationwide we are in support of healthcare. That's what's important. And of course his staffs let him know. If he didn't see us personally, they're going to let him know about us. He knows we were here in support.
Okay. And what are the next steps now?
For me or for the nation?
I mean, for today, here, for the next weeks, for you and...
Well, I know that I personally will be painting tomorrow on a giant mural trying to promote healthcare reform. So I'll just keep up my battle. There are some major players that I haven't really addressed yet, and I still have to right there. And then we'll have a little bit of the curtain coming down, because the idea is this is a stage that's set. The play's ready to begin. Now it begins, what's the resolution? Because right now, here it is. Okay, Congress. What's the final act? So, it's our play on the national stage.